Hi, my name's Dr. Robbie King. I'm a paramedic with the Queensland Ambulance Service, an advanced care paramedic and community paramedic in that role. I also lecture at the Australian Catholic University in Brisbane. So a community paramedic role is a traditional paramedic role, still trained that way with a little bit of extra training where we attend patients who may not need critical or emergency care. I came to Australia in about 2008. My history there had been a financial services manager, and I retrained in Australia with the Queensland Ambulance Service as a paramedic. Through that journey, paramedicine has changed quite considerably. We see a lot more low acuity type presentations rather than high emergency, and I went through a process of going through a diploma, then a bachelor degree in paramedicine, and as I moved into the community paramedicine role, various courses, but eventually a graduate certificate in enhanced assessment of patients and critical reasoning. My career took me into teaching and lecturing at university as well as in a clinical role, and eventually I began a 5-year journey, PhD journey, and completed a PhD thesis on patient experience of non-conveyance. So when paramedics attend people in the community and they're not transported to an emergency department at the hospital. A big career turning point for me was actually going into a role, a community paramedic type role, where I work as a single officer and we attend patients in the community whose needs might not need 2 paramedics and a stretcher ambulance. I guess simply we look at the biopsychosocial needs of that person, not just the medical needs of that person, and we can redirect them to the most appropriate healthcare for their needs. That was a huge turning point as a career in paramedicine for me. I'd reached a point where I felt I wasn't able to care for the majority of my patients, and it was a cookie cutter type approach, taking patients to an emergency department. Whereas this role has allowed me to really spend some time with people in their homes, in the community, and see those social determinants of health outplayed and why they've called the ambulance, and through that be able to actually find out the best solution for those people's needs rather than just the transfer to the emergency department. So it's probably added quite a few years of my career as a paramedic. My research is exploring patient experience of non-conveyance, so attended by a paramedic or an emergency ambulance service and not transported to a hospital ED. And that came from that community paramedic role at the time. The education was a little bit vague about what we actually needed to care for those people, and in particularly their outcomes, so patients' outcomes after being attended by an ambulance but not taken to an ED seemed to be very little explored. So I went down a pathway of how best to understand the outcomes for these people, and the realization was the best people to ask was the people that had experienced that care themselves. So through a process of defining a research question, eventually came to the point of asking patients how, or the research question was, how do patients experience non-conveyance? That led to a 5-year PhD exploring that, and substantive theory came from that about how patients improve their self-efficacy when they've received both compassionate care and also clinically competent care from paramedics. Passion in the role comes from spending time with people. Paramedics are extremely privileged to see people in their home environment, probably at their worst moments, and being able to help that person and provide them a solution is extremely rewarding. So the passion came from, or a passion for research came from seeing a system that might not have been working and trying to influence change in that system. And for me, really being able to take that patient's voice, using an evidence-based approach and then presenting that and hopefully informing paramedic education and models of healthcare to influence that change to get a better health system for those people when they use an ambulance service. I really enjoy the outdoors, so hiking, mountain climbing, And during the PhD, it was interesting. I made myself a goal of getting a PhD and running a 50K trail run before I was 50. I actually achieved the PhD just after my 50th, but also completed 5 50-kilometre ultra runs, trail ultra runs during that process as well. So I guess running, but since then I've probably relaxed a little bit